This presentation is called Your Roadmap to Medicare. We're going to go over a whole overview of Medicare, the parts and pieces, what it costs, what it covers, and the proper timing to enroll. But before we get started with all of the meat of the presentation, I'd like to just give you a quick overview of who HTA is and how we can help you with your retirement healthcare decisions. As you probably know by now, Medicare can be very overwhelming. And we are here to simplify that for you, because what happens is as you approach your 65th birthday and forever thereafter, you will receive lots and lots of Medicare mail. You will receive solicitation calls and lots of advertising. And the messages are all just a little bit different, and it can become very overwhelming and confusing. So we help find out a little bit more about your situation, what your objectives are, what your timeline is and your medical needs, and we can simplify that for you by telling you exactly what pieces of information are relevant to you. So we will simplify and personalize your Medicare experience to make it nice and easy for you to get set up. Now, we provide all of our services for free. We don't charge anything for any of our consultations or assistance, and you have unlimited support from us. You can call us at any time and ask questions. We've been specializing in Medicare for over 20 years, and we have access to over 35 and now probably over 40 or 45 different insurance companies for the related Medicare products. So you can always choose what is most important to you and what is most appropriate for your situation. In addition, we provide services nationwide. So if you have friends or family in other states, we can help them as well. We are licensed in something like 48 states right now. Now, what makes us different from a lot of the solicitations you're receiving is when you call our office, you're not going to be talking to a commissioned salesperson. Everybody in our office is a salaried employee. So yes, they're licensed, yes, they're certified, but they are not incentivized or bonused or commissioned for selling you a product. So they are here to truly hear what you have to say, help you make the right decisions, whatever best for you, and it has no impact on their overall income. So you'll never feel any sales pressure from our team. So as I mentioned, this is a complimentary service. It's available to you, your friends, your family members. Anybody can call in nationwide to get our assistance. So you may be thinking, well, this sounds too good to be true. How do they offer all of this free support without charging anything? How does HTA make their money? And just to be completely transparent, our only ask, our only request is that if you felt that we were helpful, if you liked working with my team and you thought we were friendly and added value to your experience, when the time comes for you to enroll in Medicare, please keep us in mind and please allow us to help you with that. Because by completing your enrollment applications with the various Medicare supplements, prescription drug plans, Medicare Advantage plans, maybe even dental vision, the insurance companies will pay HTA an enrollment fee to do that. And that's ultimately how HTA can stay in business and continue to provide the free education and support to you. The good news for you is you don't pay any more for the insurance by enrolling through us rather than going directly to the insurance company. So you get the extra level of support from us, and you are not paying anything additional if you were to do it on your own. So I'm going to go ahead and get started right now, just starting from the very beginning. What is Original Medicare? Original Medicare is the health insurance that becomes available to you or your friends or family when they turn age 65. So this is a straight age 65 qualification. It has nothing to do with your quote unquote normal retirement age. So you may be thinking, well, my normal retirement age is 66 or 66 and 2 months. I don't need to think about Medicare until I'm at my normal retirement age, but that's not true. Normal retirement age pertains to when you can collect your full Social Security income benefits. It does not have anything to do with Medicare benefits. So at age 65, you have a decision to make. Do I enroll in Medicare like all of the literature I'm receiving says I have to do? Or do I have a valid reason to defer my Medicare until later? In addition, you might be eligible for Medicare if you're under 65 and collecting Social Security disability income, or if you have any kidney issues like end-stage renal disease, kidney failure, kidney dialysis, or kidney transplant. Now, when you set up your Medicare insurance, there are 4 parts and pieces to make up comprehensive health insurance. So you're going to need a couple different things. And this is why many people feel that it's confusing to be in Medicare. So you're going to need the federal government program, which is Medicare A and B. You're also going to need some type of secondary insurance from private insurance companies. So that falls into the C and the D categories. Medicare Part C is Medicare Advantage, or you'll have the option to choose Medicare Supplement, which is otherwise known as MediGap insurance. And then the D program is the prescription drug plan. So think of Part D, D for drugs. So what I'm going to do is I'm going to walk through the parts and pieces of Medicare and each one of them individually and talk about what they cost and what they cover. So talking about the base Medicare program through the federal government, there's Medicare Part A, which is available to most people at no cost. So as long as either you or your spouse has paid Medicare taxes for a minimum of 10 years throughout your lifetime, you are able to collect Medicare Part A at no additional cost. That's what your taxes pay for. Part A is your inpatient hospital coverage. So I always say think of A for admission into the hospital. If you're admitted in the hospital, it's going to fall under Medicare Part A. And it does cover some other things as well, but primarily it's for inpatient hospital stays. Medicare Part B is your outpatient coverage. So think of A as inpatient and B as outpatient. So basically everything you don't go to the hospital for. For example, doctors and specialists, labs, x-rays, MRIs, surgeries, chemotherapy, even things that you do go to the hospital for, but you don't get admitted for, like emergency room treatment, or if you're there under observation, all of that falls under Medicare Part B as outpatient services. Medicare Part B does have a premium. It has a premium for everybody. However, if you are at poverty level and qualify for Medicaid, state financial assistance, the state may help you pay some of your Part B premiums, but for everybody else, there's a premium. The base premium for 2022 is $170.10 per month. However, Medicare Part B premiums are income-driven premiums. So for those in the base income level, individual tax filers earning up to $91,000 a year, or joint household tax filers earning up to $182,000, you will pay that base Medicare Part B premium of $170.10 per month per person. Now, if you're filing your tax return as a joint household, a married tax return, what they're going to do is they're going to assess your income based on the household. And when I say they, I mean the Social Security Administration. They already have your tax returns on file, and that's where you go to actually apply for Medicare. So they're going to look at your income tax return on file. They're going to determine your income level, and each husband and wife is going to pay the same Medicare Part B premium. Now, it doesn't matter who the wage earner is, who the main breadwinner is. Each spouse is going to pay the same Medicare Part B premium. And when Social Security is looking at your income, what they're actually looking at is your modified adjusted gross income. Now, if you're looking to estimate this is kind of hard to do because that number cannot be found anywhere on your tax return. It's a combination or calculation of a few numbers. But if you wanted to estimate it, what I would recommend is looking at your tax return at your adjusted gross income at the bottom of page 1, and you should be able to get a very close estimate to the number that Social Security will use when determining your Medicare premium. But the interesting thing is the tax return that they're looking at is the one from 2 years ago. So if you're applying for Medicare in 2022, they're going to be basing your Medicare premium on your 2020 income. And you may be thinking, well, that's no good because in 2020, when I was still working, I was making a lot more money than I'm going to now that I'm retiring. So there's a couple things we can do about that. Number one, you can just wait it out because every year Medicare is going to review your income when determining your next year's premiums. So for 2022, your Medicare's premium is based on your 2020 income. But in January 2023, that premium is going to be based on your 2021 income and so on and so forth. So eventually Medicare will figure out that your income's gone down, but not for 2 years later because they're always looking at that tax return from the 2 year prior. So if you wait it out, eventually your Medicare premiums will go down, but guess what? They're not going to pay you back for the overpayment that you made for the last 2 years. So what we would recommend, and when we talk to you, we'll find out a little bit about your income and find out if that's going to change in retirement. And if so, we'll talk to you about appealing the process. The appeal process is super easy. It's one form. It's called a life event form. You fill it out, indicate what your life event is, your reason for income reduction. Maybe you are retiring or you're reducing your work schedule, so your income's going down. And then it's going to give you an opportunity to indicate what your estimated income is going to be for this year. They'll review that and they'll adjust your Medicare premiums accordingly. Now, if you underestimated, 2 years from now, when they do that review, they'll say, hey, you underestimated your income here. We got to come back and charge you the balance of what you should have paid and what you didn't pay. But again, they're not going to pay you back if you overpay either. So we always recommend that appeal, and we're here to help you, give you the forms, and walk you through that whole process if it impacts you. Okay, so Medicare A and B through the federal government is great baseline coverage. It does not cover everything, and there are certain things that are excluded from Medicare. For example, dental care, vision, except for medical conditions like cataracts, glaucoma, diabetic eye checkups. Hearing aids are not covered by Medicare. And things like long-term care. I don't know if you've ever heard of long-term care. What I'm talking about is like home health aides, assisted living, nursing homes. They're typically not covered by Medicare if they're for everyday needs. So if you need help getting around and getting dressed and getting a shower, Medicare does not pay for those type things. What it will pay for is rehab services. So physical, occupational, or speech therapy, certain restrictions apply, but they do not pay for everyday help with personal needs. So just so you know, there are separate policies available to cover some of these things. There's long-term care insurance, there's dental, vision, hearing policies, and some of the Medicare Advantage plans, and you'll see them advertised on TV, may also include extra benefits for dental, vision, hearing aids, and things along those lines as well. So definitely ask about that if that's a concern for you. Now, where we find the biggest confusion lies for most of our clients is in the when. When do I need to enroll in Medicare? Because as you approach age 65, you will get bombarded with mail. And it's going to say things like deadlines, penalties, must enroll. And you may be thinking, well, I'm still working, or my spouse is still working, and I have group coverage and I'm pretty happy with it. Why do I even need to think about this now? But then as the mail continues to flood in and you see big capital letters that say penalties, you start to get a little bit more nervous and you think, maybe there's something here. I should probably look into it. So because of that, we always recommend that you give us a call around age 64 and a half, maybe right before your 65th birthday, and just check in. And we'll talk to you about your situation. Do you anticipate continuing to work? Are you covered under your group plan? Do you have a health savings account? These are all very important things to find out when determining whether or not you do or do not need to take any action with Medicare for your 65th birthday. So give us a call. It'll put your mind at ease, and we'll be able to tell you exactly what you do and do not need to do. And we'll put that all in writing to you as well. So what I have on the screen here is just an example of some of the information that we provide you with. So after every phone call, you will receive an email from us. And the email will contain specific details about what we're telling you you can or cannot do. For example, this is a copy of what we call our roadmap webpage, roadmap leading into Medicare. And we'll address things like, will you receive a penalty if you don't enroll? What is your deadline to get enrolled? And do you need to have Medicare to have full coverage? So all of those things will be answered for you in a short form manner, easy to understand. And then if you click on this little plus sign right here, a big box is going to open up, and it's going to indicate the specific Medicare rules and guidelines as to why we're providing you with the answer that we are. You'll be able to read it right from the Medicare and or the Social Security webpage with those exact rules. So that way you know you're making a decision based on sound advice. Now this little icon over here that looks like a report is actually going to take you to a one-page report. So a one-page overview telling you if you can defer or if you should enroll in Medicare and exactly why. So that's just a short form version of that webpage, not as many details, but easily printable. So many people think that Medicare is an automatic enrollment once you turn 65, and that did used to be true, but not any longer. So Medicare is automatic if you're collecting Social Security income prior to your 65th birthday. So if you're on Social Security income already before you turn 65, what's going to happen is about 3 months before your 65th birthday, you're going to receive your Medicare card in the mail. And it's going to have you enrolled in both Medicare Parts A and B. But remember, the Part B is what you pay for. And you may find after a conversation that you don't need Part B because maybe you're going to stay on your group health insurance. So if you don't want the Part B at that time, you can return the card and they won't charge you for it until you enroll in it later. Now, for anybody who's not collecting Social Security income prior to their 65th birthday, enrollment is not automatic. You're not going to get a Medicare card. In fact, you are not required to tell the Social Security Administration that you're deferring Medicare. You simply just do nothing and you've deferred your Medicare by default. So your choice at that point, and what we'll talk to you about, is do you literally do nothing and not enroll in either Medicare A or B? Or do you enroll in the free Medicare Part A only and just defer the Part B until you're ready to retire later? But it is a very important decision with lots of consideration because just like that mail says, there are some strict consequences if you don't enroll and you are supposed to. For example, there could be penalties on your Part B and your Part D coverage. You could have deadlines. And if you don't make those deadlines, there's only one time of year that you can enroll thereafter, which may not coincide with when your benefits end. So you could be left without coverage if you miss your deadlines. Or sometimes for some people, once you turn 65, the coverage that you've had all along is no longer considered primary insurance for you. And if you don't enroll in Medicare at that time, you may not have full benefits anymore. So these are all important things to consider when deciding if you should do anything with Medicare on your 65th birthday. Now, you notice that I mentioned that penalties and deadlines occur if you don't have credible coverage. So I think it's important to determine what is credible coverage for Medicare deferral. So if you have a group health insurance plan through your employer or your spouse's employer, and it's based on current active employment, then you have credible coverage. So if I'm working and I have coverage through my employer, I'm the primary insured, and I'm still working at that employer, then I have credible coverage. Or if I'm working, I'm the primary insured, and my spouse has coverage through my employer, as long as I'm continuing to work and my spouse is covered under that employer, then my spouse also has credible coverage. So things that are not credible would be individual insurance like ACA or Obamacare, or possibly group insurance that's not based on current active employment. For example, if you're on COBRA, if you have a retiree plan from your employer, or if you've been offered some kind of severance package, these are not considered credible coverage because they're not based on active employment since you're no longer working at the company that's providing those benefits. So let's assume that you are planning to continue to work and you have credible coverage. So you're on your employer's group plan, or your spouse is continuing to work and you're on their employer's group plan. So you will not receive a penalty when you turn 65, and you have no immediate deadline to enroll in Medicare. You'll have 8 months to enroll in Medicare from the time either the group health coverage ends or the employment that it's based on ends, whatever comes first. Now, whether or not you need Medicare to have full coverage is kind of up in the air. So if you're on the phone today, you're getting coverage through your current work or your spouse's current work that has more than 20 employees. If I do nothing at all today, I just want to put your mind at ease that you do not need to enroll in Medicare when you turn 65. Now, you may want to take Part A only, you may want to take A and B for other reasons, but it's not a requirement for you at that point. But if you're working for a company that has under 20 employees, we may have issues. And I have in question mark there, Medicare primary, because for many insurance plans, many group health insurance plans, when you turn 65, the group health insurance plan says, hey, this company has less than 20 employees. We no longer need to pay primary. So we're going to require Medicare A and B to be in place Now, they'll still pay secondary, so you can keep that group health insurance as secondary insurance if you want, but you'll need Medicare A and B to add to it, or else you won't have benefits for about 80% of your medical care. That would be your responsibility in that situation. So if you were to call our office and we find out that your employer has less than 20 employees, we're going to have you go back and either check with the employer or the company plan, the group health administrator themselves, and ask if you're required to have Medicare A and B as primary insurance. So let's say you don't enroll in Medicare at 65. What happens when you go to retire at 68 and you want to enroll in Medicare? Well, if you just enroll in Medicare and do nothing else, they're going to say, well, wait a second, why didn't you enroll at 65? Here's your penalty. But that's easy to overcome because there's a one-page form that your employer fills out. It works just like a golden ticket. It gets you right in the door to Medicare. So you're going to take this form. It's called a request for employment information. You're going to take this form to your employer and you're going to have them complete it. So one thing that I want to mention here is if both you and your spouse are covered under your employer's plan, you will need two forms, one for you and one for the spouse. And then you see down at the bottom here, it simply asks the dates you were covered under the plan and the dates the employee worked for the company. So as long as the primary insured was working for the company since you've been 65 and you've been covered under that group plan, this is your golden ticket in the door to Medicare. And you'll have lots of options for applying. We'll go over those with you at the time. You can apply online, through the fax machine, or through the mail. So let's say that you don't have Creditable coverage. So maybe you've stopped working early and you're on an individual plan, or you took COBRA for a few months, you've been offered a retiree plan or a severance package, and now you're approaching your 65th birthday. Well, if you're on any of these types of insurance when you turn 65, you absolutely need to enroll in Medicare. You will start to accrue a penalty of 10% per year that you wait. And you're also going to have a deadline, a short window of opportunity to get enrolled. So it's important that you address this around your 65th birthday. In addition, with individual coverage, Medicare is supposed to be primary, and with retiree, COBRA, and severance coverage, many times Medicare is primary. So what we will do is we will ask you to check with the plan administrator. So enrolling at age 65 is pretty easy. You go online, you fill out a short form. It takes maybe 5 minutes. Now, the only thing I want to caution you about here is you do not get to choose your Medicare effective date. So what month you go online during that 7-month window will determine when your effective date is. And you could have up to a 3-month delay before Medicare starts. So don't assume that if you want your Medicare to start in May, that you should go online and enroll in April, because depending on where you are in your 7-month window, you may have a 1, 2, or 3-month delay before the effective date after your enrollment. So we'll tell you, what month you need to go online to try to achieve the effective date you want. Okay, so probably the biggest piece of advice that we hear from people that they get from their friends and their family is that they can defer their Part B, the part that you pay for, but you must enroll in Part A. We hear it all the time. People call in and say, well, I enrolled in Part A because my friend said I had to. That's not always true. So you can enroll in Part A at age 65 if you want to, or anytime thereafter without a penalty or deadline. So as long as you qualify for Medicare Part A for free, meaning either you or your spouse has paid your Medicare taxes, then you don't have to enroll at age 65. You will not get a penalty. There is no deadline to not enrolling in Part A as long as you qualify for it for free. But most people say, hey, Medicare Part A is free. Why wouldn't I take a free benefit from the government? Even if I am going to continue on my group health insurance, why not? And typically that is our advice too. Why not? It's a free benefit. It'll sit behind your group health plan, and it's only for inpatient hospital care. So it probably won't provide you a lot of benefits unless you have a high deductible plan or a large out-of-pocket expense when you go to the hospital. But so what? It's free. And also it gets you established with the Medicare system. You'll get assigned your Medicare number. So when you go to apply for Part B later, the process is that much faster because you already have your Medicare number. So many times we do recommend that you enroll in Part A, even if you're going to keep working, even though you don't have to, just because it makes everything a little bit easier later. But there is one important consideration, and that's if you have a health savings account. So if you're currently on a high deductible health insurance plan and you are contributing funds into a tax-free health savings account, you cannot enroll in Part A and continue to contribute those funds to the account. So no longer will you be able to make deposits into your health savings account once you enroll in Medicare Part A. Now, don't worry, if you've accumulated a savings in your health savings account, you can continue to use the funds after you're in Medicare. You just can't put more funds in there tax-free once you're in Medicare. For those of you that have a high deductible health plan with a health savings account, we recommend that you do not enroll in Medicare Part A or B when you turn 65 if you want to continue making deposits. And we also recommend that you give us a call about 6 months before you are planning to retire or enroll in Medicare, or even let's talk through it when you turn 65 so you know what to expect. Because once you do go to enroll in Medicare later, they likely will backdate your Part A, which can impact the amount of deposits you can make in that last tax year that you're enrolling in Medicare. So it's always good to talk through that. So just to summarize, are you required to enroll in Medicare A or B when you turn 65? So for most of you on the line, that answer is probably going to be no, because your primary insured is still working, you're on that company's group health insurance plan, and your company has more than 20 employees. So if that's the case, you don't need to do anything unless you want to. The next category is the maybe category. So for those of you that are covered under an employer plan, you're still working, covered under the group insurance, but your employer has less than 20 employees, that's a maybe, and we'll talk through that individually. But for all of you that fall into the right-hand column, for example, if you're not working, you have individual coverage, no coverage, retiree COBRA, or severance coverage, for those individuals, you absolutely must enroll in Medicare at age 65, or you're going to experience deadlines and penalties. So we likely just discovered that you don't need Medicare when you turn 65 because you or your spouse is continuing to work and you have that group coverage. But would there be a reason why you may want Medicare instead of your group health insurance plan? So there's a couple things to consider here. Number one would be, do I like the plan? Is it good benefits for me? Do I have access to the doctors that I want to go to? But probably most importantly would be the cost. You know, what's it costing me to be on that group health plan? The premium and what I'm paying for my health care. So we typically say, let's look at the premium that's being payroll deducted from your paycheck, as well as what your out-of-pocket expenses are when you need healthcare, your copays at the doctor, the hospital, your deductibles, your co-insurances, everything except for your prescriptions. We add up all those numbers together and we see what the total cost is. And what we can do is a break-even analysis from there to determine, is my group health insurance more cost-effective or is Medicare more cost-effective? If your employer has more than 20 employees, then you would have to be paying at least $3,600 per year on your group health plan for Medicare to make more sense. So if your group health plan costs you less than $3,600 a year or less than $300 a month on average, meaning your premium that comes out of your paycheck plus your out-of-pocket costs. So if the sicker you are and the more you're using your health care, the more likely your group health insurance may be more expensive than Medicare. But if it's less than $3,600 a year, then your group health plan is more cost effective. Stay on it. Wait till either number one, your group health expenses go up, or number two, retirement. And at that point, we'll talk about Medicare again. But if your group costs more than $3,600 a year, then Medicare may be more cost effective. So we'll do a more thorough review of Medicare, what the benefits are, what the coverages are, so you can make an informed decision as to whether or not you should drop your group health plan and go into Medicare. Now, for those groups that have less than 20 employees, that break even is a little bit lower at $2,400. So if you're covered under a plan with less than 20 employees, then we would use $2,400 as that same break even, because you're going to need Medicare A and B regardless of if you stay on that group health plan. So one thing to consider is that your dependent spouse may be more expensive to stay on your group health plan than you as the employee. So when doing a cost analysis, what we'll typically ask you for is, what is the premium out of your paycheck for you and your spouse together? And then what is the premium out of your paycheck if you were to reduce it to single only coverage? And that difference between the premiums is in effect your spouse's premium. And many times we're finding that the spouse's premium is much higher than the employee themselves, making Medicare more attractive for probably, I would say about 60% of the spouses we work with, they find Medicare more attractive than the group health plan. Be mindful if you have a spouse that's under age 65 that's a dependent on your plan, because if you as the employee come off of the group health plan, your spouse is not eligible for Medicare yet, so their only option would be COBRA or an individual health insurance plan, which may not be very cost effective. So those are other things that we can talk through with you. So what you see on your screen here is the out-of-pocket costs if you have Medicare A and B only without any secondary insurance. And of course, we would never recommend that you do Medicare A and B only, but if you did, these would be your out-of-pocket costs. So we have the inpatient costs and the outpatient costs. So if you're admitted into the hospital, there is a per admittance deductible or a per occurrence deductible of $1,556. After that, the hospital's paid in full unless you're in there for an extended period of time. After that, you would start having some daily co-pays that you would need to pay to stay in the hospital. Now, on the outpatient side, that's where the bulk of your expenses are going to be, because remember, that covers almost everything except for hospital admittance. So that has a pretty reasonable deductible, a calendar year deductible of $233 this year. Not so bad, probably better than most group health insurance. So you pay the first $233 of your care, and then after that, Medicare pays 80% and you pay 20% of your care. Now, where the risk lies is that 20% has no cap, no maximum. So that's 20% of the $100 bill, no big deal, but 20% of the $100,000 bill also. And in addition, believe it or not, doctors can accept Medicare. In fact, about 98% of doctors nationwide accept Medicare. However, they can still charge more than the Medicare allowable rate for their services. In fact, that's legal in like 45, 46 states for doctors to be able to charge more than the Medicare allowable rate for their service. And if they charge more, that's an excess charge. And of course, Medicare is not going to be responsible for paying that either. So anything above the Medicare allowable rate would be your responsibility if you had no secondary coverage. So when we talk about secondary coverage or the Part C umbrella, there's two choices there. You can choose Medicare Advantage or you can choose Medicare Supplement. Now, Medicare Advantage is otherwise known as Medicare Part C, and Medicare Supplement is otherwise known as MediGap. So if you hear any of these terms, they can be used interchangeably. What I first want to do is talk about Medicare Supplement plans, and then we'll talk about Medicare Advantage plans and how they differ from that. So Medicare Supplement plans are designed to sit on top of Medicare and pay the deductibles, copays, and coinsurances that Medicare has. So those costs we talked about on the other screen, that's what these plans are designed to pay for you. And you may notice that I circled two plans, Plan F and Plan G. They are the most comprehensive Medicare Supplement plans available. If you look down the column at Plan F, you see 100%, pretty much all the way down, which means that all of the deductibles that we just discussed, the hospital deductible, the Part B deductible, the 20% coinsurance, even the excess charges are all paid for you 100%. So if you have Plan F, Medicare Supplement, combined with Medicare A and B, you have 100% coverage of all Medicare eligible services. No copays, no deductibles, no nothing. You pay nothing for your Medicare eligible medical care. So the second most comprehensive plan is Medicare Supplement Plan G. And you may notice that there's only one hole listed here, and that's under the Medicare Part B deductible. So if you have Medicare Supplement Plan G, along with your Medicare A and B, you're going to pay your Medicare Part B deductible, your outpatient deductible, and in 2022, that is $233. So you pay the first $233 of your medical care each calendar year, and then after that, between Plan G and Medicare A and B, 100% of your Medicare eligible services are being covered for you. So not all plans are available to you if you turn 65 after January 1st, 2020. So if you turn 65 before January 1st, 2020, you have access to all of the plans. But if you turn 65 after January 1st, 2020, your most comprehensive option is going to be Plan G. And if you're looking for a lower cost, a lower premium plan, there are certainly plans available that have slightly higher out-of-pocket medical expenses in exchange for a lower premium. So when we talk to you one-on-one, we'll talk about all of this, and we can talk more about Plan N, which has some co-pays, but also Plan N does not cover excess charges, so that's something we'd want to go over. Or Plan High Deductible G. High Deductible G gives you a maximum out of pocket of $24.90. You'll have some co-pays, some co-insurances that equate to Medicare, but it will cap your Medicare out-of-pocket risk at $2,490 in 2022. So that may be an option as well if you're looking for lower premiums. Now you may be thinking, oh, that's a bummer. I turned 65 or I turned 65 after January 1st, 2020. I can't get that Plan F. However, I just wanted to show you that it's probably not too big of a deal. Well, this shows you what Plan F costs in premium. So to buy a Plan F for, this is just an example, a female 65 in the mid-Atlantic area, depending on where you are in the United States, your cost may be a little bit lower or higher than this. But an average cost for a Plan F is about $160 per month for a female of this age. An average cost for a Plan G is about $135 a month. So if we do the math, Plan G is going to save you about $300 a year in premium, but you have an additional medical expense of the $233 deductible. So at the end of the day, Plan G does save you a little bit of money, saves you about 75 bucks, the difference in the premium and the out-of-pocket expense. So I would say, if you don't have access to Plan F because of your birthday, don't worry about it. You still have a really good deal with Plan G. If you do have access to Plan F because your birthday, your 65th birthday fell before January 1st, 2020, then it's probably worth exploring because the premium difference and the deductible difference is so minimal. It's at that point, it's more of a personal preference conversation. So let's talk about shopping the Medicare supplement plans. When we shop for Medicare supplement plans, it's very easy to do because the benefits are the same with any company that you go with. So if you have a Plan G or you're looking at a Plan G, it's going to have the same benefits with United Healthcare as it does with Humana or Aetna or Cigna or some company you've never heard of before, like American Retirement Life or something along those lines. So you don't have to worry about benefit differences. You also don't have to worry about network differences because with Medicare supplement plans, there actually are no defined doctor networks. You can go to any doctor that works with Medicare nationwide. And about 98% of doctors nationwide accept Medicare. So you should not have any problem being able to either continuing to use your existing doctors for the most part or finding new doctors. The claims paying process is also the same with all of the Medicare supplement plans. What happens is the claims first go to Medicare to determine if they're eligible expenses. Medicare pays their portion, and then they tell the insurance company what to do on the balance. And the insurance company is just required to pay that. So you're not going to find that one company pays claims that another company does not pay. And it's the same coverage anywhere in the United States. So if you like to travel or you have vacation properties or children that live in different states, you don't have to worry about your benefits being different anywhere you go in the United States. So when we're shopping for these plans, primarily what we're doing is we're comparing the premiums, who's going to give us the best premium for the benefit design that we want. And that's something that we can help you with. This is, I know you probably can't read what's on the screen, but this is just a screenshot of what we get as an output from our quoting software. So rather than making you call every insurance company and asking what their rates are and then getting stuck on the phone for an hour with each salesperson from every company, you can just give us a call, and in about 15 seconds with your age, your gender, and your zip code, we hit compute, and we can send you a spreadsheet of the prices from about 35, 40 different insurance companies. So you can see what they are and make an educated decision on what might work best for you. Now that we've talked about Medicare supplements, let's talk about the difference between Medicare Advantage and Medicare supplements. And there's 4 main differences between these type of plans, and I've categorized them here on the left. The access to care, the cost, premiums versus benefits, the extras, and how you apply, when you can apply without medical questions. So let's start over here with Medicare Advantage. Medicare Advantage are managed care plans, which means you, your doctor, and the insurance company are involved in your medical decisions and setting up your plan of care. Versus on the Medicare Supplement side, these are not managed care plans, meaning just you and your doctor are making those decisions. On the Medicare Advantage side, since the insurance companies have a little heavier role in helping with those medical decisions, these are network-based plans. Your doctor can choose if they want to participate with the plan or not. So if you see the words PPO, HMO, private fee for service, this all indicates that there's networks and they're probably Medicare Advantage plans. On the flip side, Medicare Supplement, there's no network restrictions. You can use any doctor that accepts Medicare nationwide, and that's about 98% of doctors nationwide. Now, when we're talking about the costs, there's a bit of a give and take here between the premiums and the out-of-pocket expenses. So the Medicare Supplement side is going to be higher in premium, but lower in out-of-pocket expenses, versus the Medicare Advantage side is going to be lower in premium and higher out-of-pocket expenses. So depending on if you want to pay more for something to have lower out-of-pocket when you need medical care, or if you want to pay less but don't mind taking on some additional financial responsibility when you need Medicare, could lend to this decision. Now, Medicare Advantage premiums can be as low as $0 a month. You may see some advertisements on TV that sell these plans for $0. And when you get to the point where you need medical care, you're going to pay a copay for each and every service. It's kind of like a menu of services. Maybe primary care doctors might cost $0, $5, $10. Specialists, $30 to $50. Surgeries, $200 to $400. Inpatient hospital, maybe it's $300 a day for up to 5 days per stay. The biggest expense under a Medicare Advantage plan is going to be chemotherapy. Chemotherapy in almost every Medicare Advantage plan is a 20% copay. So you're going to keep paying these copays on the Medicare Advantage side. As your services come due, you pay the stated copay for that until you've paid your maximum out of pocket for the year. And then after that, the insurance picks up 100%. And the maximum out of pocket on most Medicare Advantage plans is around $7,500. You could get it a little bit less with some plans, but that seems to be the average with most plans around the United States. Now, on the Medicare Supplement side, you're going to pay more in premium. So rather than being $0 to $150 in premium, you're looking at more $100 to $250 a month in premium. But when you need medical care, you pay much less. Remember, we were just talking about how Medicare Supplement plans pay the deductibles, copays, and co-insurances of Medicare. So if you enroll in, let's say, a Plan G, the only thing you're responsible for is that low Part B outpatient deductible. After that, it's 100% coverage, no copays on your services. Again, Medicare Supplement, higher premium, lower out-of-pocket expense. Medicare Advantage, lower premium, but higher out-of-pocket expense. The one that's really going to get you on the Medicare Advantage is probably going to be a cancer diagnosis. Because the chemotherapy has a 20% copay, and then you might have radiation and surgery and doctor visits with copays. If you are diagnosed with cancer, you're likely going to hit your maximum out-of-pocket with any plan that you have. And as you can see, that could be considerably higher on the Medicare Advantage side. Now let's talk about the extras, because that's what you see advertised on TV. These Medicare Advantage plans, they advertise really nicely. $0 premium comes with free dental, vision, hearing, even gym memberships and some vitamins. You know, sometimes it sounds too good to be true, but these plans really do throw in a lot of extras. Now, they're not always as great as they sound on the advertisements. Many restrictions apply, but it's kind of neat because it's all inclusive in your plan. And these things come included, so you don't have to seek these benefits elsewhere. Versus on the Medicare Supplement side, think of this as the a la carte side. You buy anything that you need. So you buy your medical care, you buy your prescription coverage. If you want dental, vision, or hearing coverage, you would buy that separately. And then some of the gym memberships and discounts, we can get them with some plans, but not with all plans. So the Medicare Supplement side is definitely going to be more expensive on the premium because everything's a la carte. But if you're looking for the lowest out-of-pocket on your medical care and the least amount of restrictions on doctor network access, that's going to be the side that you're probably going to fall toward. Medicare Advantage is going to give you that low premium, but you have more narrow access to medical care, and you're going to have higher out-of-pocket expenses, but you're also going to get these extras in there too, which may be very valuable to you. So one of the biggest questions that we have is, well, hey, can I do the Medicare Advantage initially because I'm healthy now? I'm only 65. I don't use the doctor that much. I like the idea of having a low premium and having some free dental and vision and a gym membership. Can I do that now? But if I get sick and I know I'm going to need a lot of medical care, can I flip over to the Medicare supplement side later? And the answer is that's not as easy as it sounds, because initially, when you first go into Medicare, you can do whatever you want. There's no medical questions with either plan. But after you've been in Medicare for over 6 months, the Medicare supplement side, the side that has the lower out-of-pocket medical costs, that will ask you medical questions to get into a plan. On the Medicare Advantage side, we can get in once a year, every year during the annual enrollment period with no medical questions. So it's easy to go from supplement to Advantage. We can do that every year, no medical questions during the annual enrollment period. But if you go with Advantage and decide you want supplement later, there are medical questions. So if you've gotten a diagnosis, then it may be a bit more difficult to get over to the Medicare supplement side later. So we're also here to help you shop Medicare Advantage. We have seen them become more and more popular over the past couple years. They're becoming more comprehensive in all of the different services that they offer. So we are talking about them a lot. Now, they're a little bit more difficult to shop for because everything about them is different. The benefits are different. The networks are different. How they handle claims is different. It varies across the United States, so we always need to look and see what regions you travel to make sure you're going to have coverage in those different regions. So typically what we'll do is we'll start by asking you for a list of your doctors and hospitals that you definitely want to make sure you have access to. We'll look them up, see what plans they accept, and then from there we'll discuss the benefits of those plans. Okay, so we finally got to the last piece of Medicare, which is the drug plan, the Part D of Medicare. These plans are going to work very similarly, regardless of if you buy them on your own, meaning you went with a Medicare supplement and got a prescription drug plan, or if you have them included in a Medicare Advantage plan. There's about 20 to 30 different drug plans available in each state, some states even more than that. All of the plans cover different medications, and the medications that they cover, they can rank them in different tiers. Every company is going to have a 5-tier structure. So every script is going to be either ranked 1, 2, 3, 4, or 5. The higher the number ranking of the script, the higher the copay is going to be. So when we shop for these plans, the best thing to do is get a detailed list of your medications, the dosage, the frequency that you take them, the name of the pharmacy that you like to shop at, and we plug all of this information into Medicare's website, and it's going to pull up the different plans that are available to you, and it's going to rank them in order from most cost-effective to least cost-effective. It's going to take into consideration the premium that you pay for the plan and the copays that you will get on that plan on your specific drugs that you're taking. And the good news is you may be thinking, okay, well, that's fine now because I know what I'm taking now, but what if I start taking something new? Well, they all do cover hundreds of medications, and they are required to cover medications in every medication category. So you should always be able to find something, but each and every year we can also reshop for you. So if you give us a call each year between October 15th and December 7th, we can go back in, edit your prescription usage list, and pull up the report again and let you know if you should stick with your same plan for the upcoming year or if you should change. And of course, if you should change, we'll handle all of that paperwork for you. Okay, so I don't want to spend too much time on this slide because this conversation is better in a more one-on-one environment when we know what medications you're taking and we can talk about how this information directly relates to your medication usage. But what I do want to go over is that Medicare prescription drug plans, Part D plans, are probably the most confusing part of Medicare. You could pay different amounts of money for your prescriptions at the pharmacy as you go through the year because every Medicare prescription drug plan, regardless of if it's something that you buy on your own because you have a Medicare supplement, or if it's included in a Medicare Advantage plan, they're all going to follow these 4 stages on the screen here. So just to give you an idea, in the beginning of the year, when you first start your plan, you're going to start off at stage 1. Stage 1 is your deductible stage, and deductible means you pay the full retail cost of the drug up until you've paid so much money out of pocket. Now, that's not per drug, that's for all the drugs that you're getting. And in 2022, the maximum deductible on a plan is $480. Now, there could be variations of this depending on what plan you go with. Some plans don't have a deductible. Some plans waive the deductible on generic medications or tier 1 and or tier 2 medications and only apply the deductible to the brand names or the higher tier medications. Once you've hit that $480 cap, you are going to go on to stage 2. Stage 2 is called your initial coverage level, otherwise known as a copay stage. In this stage, you're going to pay a copay for your drugs at the pharmacy, probably similar to what you're used to in a group health plan. You know, generics might be a $0 copay, $1, $3, $5. Brand names might be a bit more expensive, $30, $50. Maybe they're a percentage of the cost, like 25% or 40% of the cost. So you're going to pay whatever the plan's stated copay is for your tier level of drug. But every time you fill a drug, the insurance company is going to add up the cost of those drugs till you reach your next threshold. And what's going to happen is it doesn't matter what you're paying as your copay, it's going to depend on the retail cost. So let's say you fill a drug that retails at $100, but you're only paying $15 for that. Well, the insurance company is adding up that $100. And when you reach a level of $4,430 in total retail costs, then you're going to jump over to your third stage, which is called a coverage gap. Now, you may recognize the term donut hole if you've helped your parents with prescription drug plans in the past, but the normal language that they're using now for this stage is called a coverage gap. Once you reach that threshold in retail prescription costs and you reach your coverage gap, you're going to pay 25% of the cost of all of your medications for a set period of time, until your drug cost reaches about $7,000. And when you get to $7,000, you're going to go to your fourth and final stage, which is called the catastrophic stage. And from that point forward, you're going to pay 5% of the cost of your medications for the rest of the calendar year. Now, in January, that starts all back over at stage 1, your deductible. Now, like I said, when we look at your prescription plans for you, we're going to ask you for a list of your drugs. We're going to pull this up, and the report tells us month by month what stages you're going to be in and what your cost of those drugs are going to be in the stage. So we can illustrate this pretty nicely so you can know what to expect for your costs throughout the year. It's a lot harder, like I said, to talk about it in generic terms. But people that are taking inexpensive prescriptions likely won't pay a lot for their drugs and probably won't ever get out of stage 2. People that are taking moderately cost medications, maybe a brand name or two, maybe an insulin or so, you may go through these stages slowly. You may get stuck in your donut hole and never really quite reach that next threshold to come out of it. But for people that are taking really, really expensive medications, those specialty drugs, those ones that are new to the market, the ones that cost $10,000 a month, you're going to go through all 4 of these stages relatively quickly. We have some clients that are on real expensive meds and they get to stage 4 by month 2. And in that case, you're going to be capped at 5% of the cost of your drug once you hit that stage. So I know that was pretty confusing. Like I said, this is more of a one-on-one conversation, and we will be glad to illustrate this for you once we know what prescriptions you're going to need and be taking. So just like you have to pay more for your Medicare Part B if you earn a higher income, you have to pay more for your Medicare Part D, your drug plan, if you earn a higher income. So as you can see here, if you're in the base income level, you're going to pay your premium, whatever the insurance company charges. That's the only thing that you pay. And the average premium is about $30, $33 is the national average. However, I will tell you that probably more than 70% of our clients are on a plan that costs less than $20 a month. There's some very popular plans that cost $13, $7. So you would pay your premium only if you're at the base income bracket. But the government will charge you a monthly surcharge if you're in a higher income bracket on your Part D plan. So the premium will be billed to you by the insurance company. The income surcharge will be billed to you by the federal government, by the Social Security Administration, the same people that bill you for your Part B. So let's just summarize how all of this, I know we went over a ton of information, lots of parts and pieces. Let's see how they all fit together. So for folks that are in the base income bracket, your Medicare Part A is going to cost $0, assuming that you've paid your taxes. Your Medicare Part B costs about $170 a month. If you have a Medicare supplement, in this example here, we have a Plan G, which is just that $233 out-of-pocket risk, and then after that, 100% coverage. Average cost for that is maybe $135 a month. It's going to depend on your age and geographic area, of course. Prescription drug plans, like I said, we have a very popular plan this year that costs about $13 a month. Of course, your plan selection would be based on your individual prescription utilization, and we can help you choose that once we know what prescriptions you're taking. And then there's no drug surcharge because you're in the base income bracket. So for individuals in the base income bracket, we're looking at about $300 to $350 per month per person in premium. And that's if you have a comprehensive Medicare Supplement Plan G. If you have a Medicare Advantage plan or one of the higher out-of-pocket options, your premiums can certainly be lower than this. And that's going to go up by about $100 for each income bracket, estimated, give or take. So if we were to look at the highest income bracket, that's for individual earners earning over $500,000 or households earning over $750,000. You can see that the Medicare supplement premium and the prescription premium didn't change, but now you're paying more for the Medicare Part B. You have an income surcharge on your drug plan. So for individuals in the highest income bracket, you're going to pay more like $800 to $850 per month per person for a plan similar to what you see on the screen here. So that's all I have for you today. I hope you got a lot out of this presentation. If you need any help, have any questions, want our assistance, or to set up a consultation, just give us a call at the number on the screen. I've also put up the email address, medicare@htafinancial.com. You can email us. We can send you an online scheduling link if you'd rather schedule online. What'll happen is we'll do a short intake process where we ask just some, basic information from you so we can set a phone appointment. And we'll set a phone appointment for a date and time that's convenient to you. Again, I wanted to thank you for your time, and we are looking forward to working with you.